Fentanyl is safe in my eyes compared to benzos and fent. People are dying without even having the tinfoil down. You know, they're taking a hoot and they're just dead.
We've started to see tranq come into the dope. People are getting extreme injuries and wounds. You can see down to the muscle tissue and the bone, large abscesses and like infections where they're injecting.
This tranq is intense. Like you feel like you're literally gonna die.
Do you feel any sense of responsibility for some of these new chemicals that are kind of replacing fentanyl?
No. We knew the traffickers would continue to try. We want to absolutely prohibit all of these synthetics from coming in.
The benzos are gonna kill a lot of people, and it already has. It's already started.
Why is this being cut into everything?
Because it's so addicting. That's what everybody wants. That ultimate high. Human error that we make costs lives. You can put one batch out and it might kill a lot of people.
Backseat.
My mom did the same trade for many, many years. Was introduced to it at a young age, and I just sort of followed in her footsteps. And here I am. Everything changed when fentanyl became on the market.
Keisha's a drug dealer who asked us to only use her first name. Over the 20 years she's been selling, she's seen the supply change dramatically. For the last decade, both Canada and the US have been ravaged by an overdose crisis, largely fueled by the synthetic opioid, fentanyl. The pandemic made it worse by disrupting the drug supply and cutting people off from harm reduction services. But the crisis is now reaching another turning point. Chemicals made in labs are infiltrating the drug supply and being combined with fentanyl to make something more dangerous. And nowhere is this more evident than in British Columbia.
You went from seeing brown substance, which was heroin, and then you're like, okay, what the is this? Because it's purple and blue and pink and all these weird colors. Okay, so I just have to wait till it settles.
Despite the shifting supply, Keisha still sells fentanyl. She mixes it with purple food coloring to differentiate it from cocaine, and she cuts it with monk fruit, an organic sweetener she says is safer than other cutting agents. Still, it's not safe. Fentanyl is up to 50 times more potent than heroin. It's been linked to at least 250,000 deaths in the US and Canada.
The risk is extremely dangerous every day. You know, anything can happen. See how there's like smoke coming out? That's the dangerous part of it.
Just because it's so potent?
Yeah.
When you think about fentanyl, it's always in the abstract, and she's using like just these normal kitchen tools and food coloring. It's very like basic. Keisha cooks her fentanyl every few days in a process that takes hours. She charges $10 a bag and can sell up to 5 ounces in a day for as much as $15,000.
What I see is that people need fentanyl more than heroin, like more frequently. Like heroin, you used to be able to do a smash or, you know, do a couple points and you'd be good all day and all night. Well, people who use fent, they need it every like 3 hours.
So it just doesn't last as long.
Doesn't last as long, doesn't have legs.
To make the fentanyl's effects last longer, other suppliers have been cutting it with ultra-potent chemicals. One, called Atizolam, is from a family of sedatives called benzodiazepines. This cocktail is being sold as benzo dope, a drug that's deadlier and more addictive than the sum of its parts. In January, benzos were detected in more than half of fatal overdoses. So fentanyl hits the market. It's like the worst overdose crisis we've ever seen. And now there's benzos in the fentanyl. How has it changed things?
I've never seen anything like it. I've seen people do hoots and they're like literally folded in half on the ground for hours. They're gone for. The benzos are gonna kill a lot of people. And it already has, it's already started. And everything is cut with it. Everything. It's very hard to find somebody who you can trust to get just raw fent and not cut with any benzos. Fentanyl is safe in my eyes compared to benzos and fent.
That's a shocking statement, though, for you to say that fentanyl, which has killed thousands, hundreds of thousands at this point of people, and you're saying that it's safe compared to this new dope that you're seeing.
Yeah, way, way more safer.
Keisha considers herself an ethical dealer because she doesn't cut benzos into her fentanyl. Addiction specialists have been advocating for keeping the drug supply safe for years. They point to countries like Switzerland, which created a prescription heroin program to help curb overdose deaths. And in the last few years, a handful of clinics in British Columbia have taken safe supply a step further, prescribing medical-grade fentanyl for people severely addicted to opioids. But these programs can be hard to access. So Keisha says her customers and friends rely on her for benzo-free fentanyl.
So those are all marked?
Yeah.
And then these, what are these, half grams?
Yeah.
Okay. Well, tell them to off.
Well, looking at it, you wouldn't be able to know that there was benzos in here or not. They put it different colors, but there's no way that you could tell that you had benzos in it unless, someone told you. People would mark their drugs with different colors, so, the purple stuff is good or the, green stuff is good. Problem with that is other people would hear what's good on the street and then they would
want to say if somebody overdosed on it, they want it.
They want it, and,
It just keeps getting stronger and stronger because of the benzos in it. Now, guys, if you give them dope without benzos in it, they don't even get on sick.
No, yeah.
So it's no good. They can smoke that shit all day.
And
But
still
once you get
sick.
the benzos in it, they love it. But it makes them forget everything.
Yeah.
It just gives them like amnesia. Nobody remembers where they put their dope. Everybody loses everything. Everybody gets robbed. It's good for people that sell dope, though. They always got to come back.
Okay, and then these are halves.
Okay.
Keisha's house is a place for her customers to come and go, using her drugs there. She has naloxone on hand and says she's used it to reverse hundreds of overdoses. She lets people stay there. Some of them are trying to wean off benzo dope. And she's picked people up off the street who look like they need help. They just found this young girl, and she's like 19. She was outside of a hotel at night, freezing cold. They brought her in, and she's hooked on benzo dope. So they're trying to give her some of Keisha's fentanyl instead. She seems really freaked out. She just keeps shaking, and she's just really jumpy. She's talking to herself a lot. She just seems very scared. Not everyone Keisha offers to help gets off benzo dope.
Do you have any of the gray stuff on you?
The pink stuff is what I was more shooting at. That pink shit, raw shoots. One thing.
One of her friends, Gord, is dependent on benzo dope.
This is dangerous shit. Listen to me.
Yeah.
I'm not even kidding.
This right here is a pink right here. This seems to be the higher categorized benzo shit out there right now. This is the dropper, man.
It sure runs on the tinfoil real fast, eh?
Jumps around a lot.
You can smell that shit.
People are dying without even having the tinfoil down. They're taking a hoot and they're just dead. Gord, wake up. Come on. Cuz. Gordo. Cuz.
Yeah.
Hey, can you get up? You can't even tell if they're actually going down because they're still talking to you and then they're going out. Gordo. His skin color's going a little funky. You go from like this normal skin tone to like a white like light blue, and then and it's like the life is being sucked out of you. Where's the Narcan kit? Gord, wake up or I'm gonna Narcan you. They call it robbery dope. You can give somebody a hoot and you don't even have to rob them. You just let them do a hoot and they're out. Gord.
My sister died here, and I just can't deal with, like, I flip right out, and I can't, like, it's really hard for me. I just want to help, and I don't know what to do.
Gord, do you need some naloxone or what?
Yeah, no.
Okay. Are you hungry? Did you eat? Did you eat?
No.
They just become like zombies almost, like they're just there. Benzos are just insane. It's scary shit.
The other night was pretty intense. It looked like Gord was gonna overdose. So we're checking in on him to see if he's okay. How are you feeling today?
Pretty tired from yesterday.
I do want to talk more about what happened because it was pretty intense.
Yeah, I don't even remember.
You don't?
Nothing.
Okay.
Yeah, I don't remember anything.
Do you remember like me being here? Or
yeah,
anything?
I remember you being here, and I remember talking to you, and I remember putting some on a foil and smoking some of it, and then that's it.
That's it?
Yeah, I don't remember like what happened after that.
You know, your cousin was saying that she's worried that you might die.
Yeah, I know. She has been for a while.
What do you think's gonna happen with you in the next like couple months?
I think that I'll probably die.
You do?
Maybe, yeah. Like if I make it to 40, I'll be surprised. Like I'm 39 now and I'll be 40 in May. I'd be pretty surprised. Most people I know only make it to 27, 28, 29, 30, around there, right? I know someone that dies every day almost.
There's a generation of young drug users who only know the new reality of a supply with potent synthetic drugs. There's been a jump in teen overdose deaths, both in British Columbia and in the US.
My ex was so addicted to benzos, I constantly had to smoke it, and I'm trying to get over it now. Yeah. But I am addicted to the nod, and I'm trying really hard to get over it.
When did you tell there was something off with the dope?
I figured out there was something wrong with the dope when I was given one hoot, and I woke up the next morning with my pants around my ankles.
Oh, Jesus.
And I realized if I was raped and I didn't wake up, and I just not through any of it, I should have woken up, especially if it was normal dope. I still would have woken up.
Carrie began using heroin when she was 13. 3 years later, she's addicted to benzo dope.
I have had a lot of pain and trauma in my life, a lot. And it just, I'm sorry. A lot of my trauma and pain could have been prevented if I didn't make the choices that I made. And I just want to, share my story and stuff to prevent a lot of other girls from either going through that or girls who have experienced it so they know they're not alone and that they can get through it.
Can you tell when there's a difference between the benzo dope and then the other dope?
I can see a big difference. It's like you smoke a good amount and then after a while you kind of start to nod. And benzos, you don't even get to blow that out yet and your face is already in the ground.
Have you overdosed?
Oh, yeah.
Like how many times?
Many. I don't remember.
Carrie moved out of her mom's house in November after her mom told her she couldn't stay if she kept using drugs. She's been homeless and couch hopping since. Carrie's dad says that sometimes he goes weeks without hearing from her. When's the last time you saw Carrie?
2 or 3 weeks ago. Met her at McDonald's, bought her a coffee, had a nice little talk, got to hear I love you. But it's a shell. It's not my daughter. It's the shell of her. It's not who I used to know. I've got 4 biological kids, 3 of them are stuck in addiction. There is no norm in my life. There's no normal Christmas, there's no normal family dinners, there's no normal Thanksgiving. You can't bring any of them into the house because they take. And I understand it's a survival mode. It doesn't make it right.
Have you noticed a difference in how Carrie's been in the last couple years since she started using benzodope?
I see weight loss to the point of serious concern. I recognize her physically, but there's no emotion that I recognize. That's not my child anymore. I don't know if any of my 3 kids have died in the last 20 minutes. That's reality. I don't. I know they have not died 24 hours ago because the police have not phoned me to identify a body. But that thought goes through my mind every day for all 3 of my kids.
And what is that like for you as a dad?
Kills you. The biggest fear is the death. Her elder sister, between 8 and 12 times I've gone to the Abbotsford Hospital for overdose. And when you look at your child and 0 response, you wonder if the next time you're looking at her is to identify him.
So we have spent some time with dealers, around Abbotsford who are selling a version of fentanyl that they say is not as toxic as the benzodope and some of these newer drugs that are kind of hitting the market now. What do you make of that?
They can try and justify that they're selling a better dope, a cleaner dope. Death is still death. Fentanyl has killed, has taken lives. Every person that sells fentanyl should be charged with murder. Somebody has died because of what they have sold. They're justifying in their own mind why they're doing what they're doing. But at the end of the day, they're still dealing death. They're still ripping families apart and they're still burying people.
Drugs mixed with fentanyl aren't the only thing making this latest wave of the overdose crisis so deadly. Black market chemists are creating designer drugs in labs, manufactured to mimic the effects of traditional drugs while stopping just short of breaking the law. Data exclusively shared with Vice News shows powerful substances showing up in the US's illegal supply. A new stimulant that can kill you is being sold as Molly and ecstasy in 9 US states. A synthetic cannabinoid that can put you in a coma or kill you has been found in 13 states. And a synthetic opioid, 20 times stronger than fentanyl, is being sold as dope in 20 states.
So early on, the opioid crisis was linked to prescription opioid tablets that then sort of evolved into the heroin period. That heroin period then evolved into what was considered the third wave or the fentanyl wave. I think it's very clear now that we've entered this polydrug wave when you have fentanyl being mixed with other stimulants or benzodiazepines or other drugs.
These new drugs are all being tracked and monitored by Alex Krotulski, a forensic toxicologist at NPS Discovery. Over the past 4 years, his program has identified over 100 new drugs in the US, more than 30 in the last 12 months.
What we've seen is that when the DEA generally schedules a drug or a class, it does go away. However, that opens a door for a new drug to take its place.
I've heard this sort of race to keep track of all these different drugs described as a game of whack-a-mole, where new ones just keep popping up. Is that an assessment you would agree with?
Synthetic drugs, it does feel like a bit of a game of whack-a-mole. So we generally understand that they may go away, but it's really hard to predict the next thing that's going to come.
To find the new synthetic drugs, Alex and his team get street samples from medical examiners, coroners' offices, crime labs, and other public agencies.
So these are heroin packets that were sent to us. Knowing that it's from Philadelphia and knowing our history, I would assume that it has fentanyl and xylazine.
Xylazine is a tranquilizer most commonly used on horses, but it's now being used to make the effects of fentanyl last longer. Like benzos, it knocks out users for hours at a time and doesn't respond to naloxone, which makes identifying it in the supply all the more important for scientists like Krutulski.
Each drug has their sort of own fingerprint associated with it, so we're able to pair up the chemical fingerprint of the drugs in our sample with the chemical fingerprint of the drugs in our library database. So this is an example of a powder that contains xylazine. So you have this big xylazine peak right here, which again matches to our library against xylazine, and then a fentanyl peak over here. So this is what we very commonly see in samples from Philadelphia.
So this one has more xylazine than fentanyl.
So there's 24 times the amount of xylazine to fentanyl in here. It's a massive amount. And unfortunately, this is not uncommon for us to see. We do see very, very large amounts of xylazine compared to fentanyl.
Xylazine has been detected in at least 10 states, but is most prevalent in Pennsylvania, where in 2020, it was found in a quarter of all of Philadelphia's fatal overdoses, a 19% jump from 2019. Why do you think xylazine has infiltrated the fentanyl supply in Philly to this degree?
I wish I had an answer. I think that's sort of, in some parts, the million-dollar question right now. It's been extremely surprising to me how long xylazine has stayed around and how ubiquitous it now is in the Philadelphia opioid supply.
Fentanyl cut with xylazine is called tranq, or tranq dope. Its impact in Philadelphia is most evident in Kensington. The neighborhood's commonly called an open-air drug market because people buy, sell, and use drugs like tranq right on the street.
We have 8 tables today. Table 1, Narcan, fentanyl test strips, water, hand sanitizer, masks.
5 years ago, Sarah Laurel founded Savage Sisters, an organization that runs sober living homes, needle exchanges, and naloxone trainings.
I ask that you just be really mindful that we are walking into their territory. This is their space. And we want to meet them with love and light and kindness. We're giving them everything that we can for free. We're here to help. And let's go serve our beautiful friends in Kensington.
Oh, yeah,
yes.
When I was getting high, it was just fentanyl and heroin. And recently, they've been putting tranquilizer in it. And it is so dangerous because people are getting a lot of open wounds on their skin. They're getting infections, and they're continuously injecting it. They look like they are not alive.
We are heading to McPherson Square Park, known on the streets as Needle Park. It's where we do our outreach every week, and it's where a lot of my friends are currently homeless.
Last year, Philadelphia's health department reported that 91% of heroin and fentanyl samples also had xylazine.
There's people in this park that need help, but I want to let you know that if you're a user, if you're on heroin or you're on fentanyl, and please get off that because it's gonna kill you.
We're in Kensington with Savage Sisters. They've set up tents to help people who are using tranq with their wounds. I've seen people with missing fingers, with blackened skin, really serious lesions.
Some of this are cuts and some is just really dry blood. Do you shoot up your hands? All right, well, for the time being, I know it's easier said than done because wherever you find one, you want to use it, but try not your hands, okay? Because your hands are a little beat up, babe.
Can you describe the extent of some of these wounds? Like, they seem very serious.
Some of them are open, they're gaping, there's tissue exposed. Some of it's down to the bone. Some of them just look like small open sores on the skin all over. It can be on their hands, on their neck, and on their face, and it's going untreated. We see a lot of people that are having to lose limbs because of it. And then we see other individuals that maybe haven't lost it yet, but most likely will.
Let me take a look at you, hon. You want me to clean that up a little bit? Can I see that finger over there? Let me get that cleaned up a little. Boy, this is angry. You need to be on an antibiotic or something. I mean, you don't want to lose more of your finger, right? You get yourself to that emergency room, okay, tomorrow?
What's happening with your hands?
Sepsis is caused by whatever they're putting within the drugs, right, is coming out in just about anywhere in the body. You know, I've never chewed up in my hands, but yet I get abscesses in my knuckles, in my tips of my fingers.
Do you have these types of abscesses in other parts of your body?
A lot of internal.
A lot of internal.
Yeah, a lot of internal abscesses, right?
You lost your other finger, right?
Exactly. That was because of the trank. Got infected, and the treatments wasn't working, and eventually it just like died, turned pure white.
Do you think that you might lose that finger?
Yeah.
While some try to avoid trank, others like Sam Brennan need it. How was the high different from the fentanyl?
It's really not even like a high. It's like you do it and you go out, you don't remember going out, and you wake up and you're sick. And it's that quickly. And it's a way more intense sickness than fentanyl was. Like, brown dope was like you're hardly getting sick from that. That was like nothing. Fentanyl was a little bit worse, but this trank is intense. Like you feel like you're literally gonna die.
You've got sort of a cut on your neck.
Yeah. It's
It looks painful.
Yes, it's from interjecting with the xylazine, the trank. Sometimes I muscle pop, intermuscular, because this hurts so bad. But when I intermuscular it, whatever's in it, it's making those lesions, and I get holes, and it just like eats away at your skin. It's like not even about getting high anymore. It's about not being sick.
One reason synthetic drugs are taking up so much space in the drug supply here might surprise you: U.S. foreign policy. From 2014 to 2019, much of North America's fentanyl supply came from one place.
As you know, most of the fentanyl, which is killing 80,000 Americans a year, it comes through China.
But in 2019, China, under pressure from the Trump administration, banned fentanyl. Seizures of fentanyl in the U.S. supply dropped that year. Only it didn't last long. Companies in China pivoted from selling fentanyl to marketing substances that mimic its effects, as well as the compounds that make it up. Those compounds were bought by Mexican cartels, who are now manufacturing fentanyl and trafficking it back into the U.S. Over 100,000 Americans died of a drug overdose in the one-year period ending last November, the most in U.S. history. Jim Carroll was President Trump's drug czar. He led the push to get China to ban fentanyl. We have record overdoses in the U.S., and fentanyl is still pervasive. So do you think that the ban was successful?
It was successful because the flow of fentanyl from China to the U.S. ended. So that part was absolutely successful. In terms of, the number of Americans dying, clearly right now that's not a success. And now with more availability than ever before, with not only the amount of drugs, but the lethality of the drugs that are on the streets, that's what's causing a rise in these fatal overdoses, these poisonings that are taking place across the country.
Were you worried about creating a vacuum for more potent drugs?
We know, and we knew back then, that eliminating China as the main source, a direct source, that the traffickers were not going to end that quickly. We knew that they would take other steps to get it into the U.S., but you have to try. You have to stop it as much as you can.
Our reporting has shown that there's actually new tranquilizers and benzos that are now being cut into the fentanyl supply. And so that's making the fentanyl supply even more dangerous. More people are dying. Were you concerned about that being a possible consequence of the fentanyl ban?
Yeah. At the beginning of this, everyone called this the opioid crisis. We don't have an opioid crisis, we have an addiction crisis. We don't know what drug, quite frankly, will be here 20 years from now. We need to treat this as the disease we know it is and make sure that we know exactly what is coming into the US and try to curtail the trafficking of drugs into the US.
Do you feel any sense of responsibility for some of these new chemicals that are kind of replacing fentanyl?
No. We knew the traffickers would continue to try. We were able to get a ban on fentanyl. We want to absolutely prohibit all of these synthetics from coming in. What we're seeing in some of these cities is a switch to a new drug, a different drug. It doesn't mean that they switched, because of something that, we did wrong. They're switching because that's what's available. Traffickers, whether it's from China or Mexico or someplace else, will send whatever drug they have to the US in the hopes that someone will become addicted to it and continue to buy it.
Do you have faith in being able to stop the supply? I mean, we've had 50 years of the war on drugs and it hasn't really worked.
It's worked when we've made a decision to stop it. It made the difference when we went to China and said, stop sending it to the US. We were able to drive down the availability of some of these drugs.
But now it's worse than ever. Teen overdoses are up as well, and apparently it's due to the potency of the drugs.
Right, because it's cheaper and easier to have incredibly lethal synthetic drugs than ever before.
That's partly because the chemicals used to make fentanyl, benzodope, and trank dope are being sold online.
A lot of the supply chains have kind of emerged through the internet. If you leave that out of the picture, then you're missing a lot of sort of that initial stage in the supply chain of where some of the stuff is coming from.
Nicole Cook is a narcotics analyst tracking websites advertising these drugs on the open web. The websites can be sophisticated, with high-quality photos, product descriptions, and customer reviews. The companies often list CAS numbers, a string of digits that correspond with a known drug.
The first step that I'll do is I will search for the CAS number. So if you don't know what it is for a specific chemical that you're interested in, you can really easily just bring it up on Google. You can search for example, xylazine. So once you have the CAS number for the chemical you're interested in, then you just enter it in here, and it will bring up sort of hundreds of advertisements for the chemical that you're interested in. So see, it looks like we have about 700 advertisements right now from 109 different suppliers.
Wow. Wow, 109 suppliers.
Yeah.
Just on this one site.
Just on this one site. So here's another example of a xylazine advertisement. Minimum order quality is 1 kilogram, so quite large. But when you scroll down to the bottom of the advertisement, you have this other hot products section where you see it's just a list of, I don't know, maybe 20 or so. And right away to me, this jumps out. This is a fentanyl precursor. As far as I know, has nothing to do with animal tranquilizers or any sort of veterinary purpose. So this whole list here, I think, is probably going to be pretty useless to you if you're using xylazine and its like licit intended purpose.
But could be very useful if you were an illegal drug supplier.
Sure, yeah.
Do you think that these companies realize that these chemicals are being diverted into the black market?
I think that the way that they're advertised suggests at least a knowledge of who the end user ends up being, given that they're often bulking these chemicals together with other ones that can be used for fentanyl synthesis. Once a synthetic drug is controlled, they will tweak the chemical structure of it so that way it's different enough that it's not covered by the law, but you still get the same sort of end effect.
I feel like, I don't know, my head is spinning a bit because it just seems like there are so many different avenues that you could pursue that if one gets shut down, there's like a million other ones that you could chase.
Yeah, and that's really the challenge when it comes to regulating that side of the drug crisis is that once you control a substance, another one will just pop up in its place.
We wanted to contact a supplier selling synthetic drugs on the open web. After several attempts, we managed to get through to a salesperson for a chemical company based in Wuhan, China. I'm interested in some of your products. Can you talk on the phone? Oh, typing. Sorry, friend, WhatsApp, unable to answer call. Okay. She's saying, which item are you interested in? So I asked if they carry Xylazine, and the response was, yes, friend, available, sent to USA, ? Yes, I'm in the US. Will there be any issues with customs? UPS friend, guarantee safe delivery 100%. I'm asking, do you know if you can combine this with fentanyl, meaning the Xylazine? She says, haha, friend, fentanyl banned in China, we don't have it. Is Xylazine similar to fentanyl, the effect of it? She says, I guess so, friend, as it's very hot in the USA. I'm just surprised by their reaction. I thought that the second I mentioned fentanyl, they would want to stop the conversation. And instead they're telling me that Xylazine is hot in the USA, in response to me asking if it's similar to fentanyl. Do you know what it's being used for in the US? Friend, for safety, we never discuss with client for the purpose. Sometimes it's sensitive for clients, ! And sometimes if clients told you they use chemicals to make forbidden drug, ! Then it's illegal for us to sell items to them. I'm asking if these products are legal in the US. They are legal in China, haha. I said, what if it gets seized by US police? They said, we resend you. So very straightforward, very honest answers, and it just makes it seem that much easier to get your hands on pretty much any chemical you want. Like, this isn't even the dark web. To address the crisis, President Joe Biden is picking up where the last administration left off. In March, he released his 2023 fiscal year budget. It includes $18 billion for domestic and international law enforcement and to try to disrupt the flow of drugs into the US. But Biden's also proposing something no other president has done, a historic $85 million specified for harm reduction services, like getting people fentanyl test strips, sterile syringes, and naloxone. Only Congress still needs to pass it. And even if they do, dealers like Keisha warn it's not enough.
The drugs are only going to get stronger. Eventually, there's not going to be anything to do with heroin or fentanyl. It's going to be all chemical, all from the dark web, all just something people have thrown in a bowl and sold it as fent or heroin. All the people I knew during when I was young, growing up, to now in the drug trade, they're all dead. I don't see anybody, nobody's face is familiar anymore.
I could have been an athlete, but instead I chose the street, pumping dope and holding heat. Nothing but nightmares when I sleep. I woke up so many cold and hungry nights up in that Bing, but I wouldn't change a thing.
Almost 2 months after our trip to British Columbia, we learned that Gord's body was found under a bridge. He died of an overdose a month before his 40th birthday.
On and lead, leaving him dead. The feds, I'm dodging and weaving them like Adrian Peterson.
Yo.
Or something like that, right?
Not bad.
I'm on some East Coast shit, right? But I'm in the West, though, right? I still got time, but, like, I feel like It's closing in, right? And I gotta do something soon.
I'm Michael Learmonth, editor-in-chief of Vice News. Too often, traditional news outlets shy away from the real stories and experiences of those living through global conflicts. Not Vice News. Our reporters are on the ground, fearlessly covering the human stories that shape our world. You and millions of others can continue to read, watch, and listen to Vice News for free. But we hope you'll consider making a one-time or ongoing contribution of any size at vice.com/contribute. Every contribution, no matter how big or small, helps support the journalism Vice News brings to you every day. Thank you.